Stop scrolling. Are you tired of acne, dark spots, and oily skin that just won't clear, no matter how many products you try? If your skincare isn't working, you're missing the real cause. Let's fix that today. First, click the subscribe button. Acne does not happen because your skin is dirty. It happens when excess oil production, clogged pores, bacterial growth, and inflammation occur together. Your sebaceous glands produce oil to protect the skin, but when hormones, especially androgens, stimulate them too much, oil increases. That oil mixes with dead skin cells and blocks pores. Inside the blocked pore, bacteria multiply, triggering redness, swelling, pus formation, and sometimes deep cysts. If your routine only cleans the surface but doesn't control oil production, cell turnover, and inflammation, acne will keep returning. One major reason acne does not go away is incorrect treatment for your acne type. Blackheads and whiteheads are non-inflammatory and respond well to salicylic acid and retinoids. Red, painful pimples and cysts involve inflammation and bacteria and often require benzoyl peroxide, topical antibiotics, or even oral medication. Using random trending products without understanding your acne type often worsens irritation and damages the skin barrier, leading to more breakouts. Overwashing is another common mistake. Washing your face more than twice daily strips natural lipids from the skin. When the barrier is damaged, the skin reacts by producing even more oil, creating a cycle of shine and breakouts. Harsh scrubs and alcohol-based toners increase inflammation and post-inflammatory hyperpigmentation, which is why dark spots remain long after pimples heal. Hormones play a major role, especially in adult acne. Breakouts around the jawline and chin are commonly linked to androgen sensitivity. Conditions like polycystic ovarian syndrome, PCOS, stress-induced cortisol elevation, and menstrual cycle fluctuations increase oil gland activity. In these cases, topical creams alone may not be enough. Doctors may prescribe spironolactone to block androgen receptors or certain oral contraceptives to regulate hormonal fluctuations. Severe cases sometimes require isotretinoin, which reduces sebaceous gland size and significantly decreases oil production long-term. Diet does not directly cause acne for everyone, but high glycemic index foods can increase insulin levels, which stimulates androgen activity and oil production. Diets high in sugary drinks, refined carbohydrates, and excessive dairy may worsen acne in some individuals. Sleep deprivation and chronic stress increase inflammatory markers in the body, making breakouts more persistent and slower to heal. Treatment must match your skin type. Oily and acne-prone skin benefits from salicylic acid, 0.5 to 2%, to unclog pores. Benzoyl peroxide, 2.5 to 5%, to reduce bacteria. Niacinamide, 4 to 5%, to regulate oil and calm inflammation. And adapalene at night to normalize skin cell turnover. Moderate inflammatory acne may require short-term oral antibiotics like doxycycline under medical supervision. Severe nodulocystic acne often responds best to isotretinoin, prescribed and monitored by a dermatologist. Dry, acne-prone skin requires a gentler approach. Overuse of strong benzoyl peroxide can worsen dryness and irritation. Azelaic acid, 10 to 20%, is effective for acne and dark spots while being less irritating. Low-frequency retinoid use, combined with ceramide-based moisturizers, helps repair the barrier while treating breakouts. Hyaluronic acid can support hydration without clogging pores. Combination skin needs balanced treatment. A salicylic acid cleanser once daily, niacinamide serum for oil control in the T-zone, a lightweight non-comedogenic moisturizer, and a retinoid at night 3 to 4 times weekly can regulate both oiliness and dryness. Spot treatment with benzoyl peroxide should only be applied to active pimples rather than the entire face. Cystic acne, which appears as deep, painful lumps under the skin, does not respond well to over-the-counter creams alone. It often requires oral medication, corticosteroid injections for large inflamed nodules, or isotretinoin for long-term control. Squeezing cystic lesions increases the risk of permanent scarring and post-inflammatory hyperpigmentation. Dark spots after acne, known as post-inflammatory hyperpigmentation, are caused by increased melanin production triggered by inflammation. These marks are not scars, but pigment changes. Ingredients like azelaic acid, retinoids, niacinamide, vitamin C, and daily sunscreen use are essential for fading them. Without sunscreen, pigmentation can worsen and last for months. A simple evidence-based routine is more effective than a complicated one. In the morning, use a gentle cleanser, apply a treatment product such as niacinamide or benzoyl peroxide if needed, follow with a lightweight moisturizer, and always apply broad-spectrum SPF 30 or higher. At night, cleanse, apply a pea-sized amount of retinoid, and moisturize. Results typically take 6 to 12 weeks. Stopping early prevents improvement. If acne persists beyond 3 months despite consistent treatment, becomes painful, leaves scars, or significantly affects confidence, medical evaluation is necessary. Acne is a chronic inflammatory skin condition, not a hygiene failure. When you understand the biology, oil regulation, bacterial control, inflammation reduction, and hormonal balance, treatment becomes effective. Your skin is not stubborn. It just needs the right science-based approach, used consistently and correctly.